for Dr. Avinash, where he said that a patient comes and asks that is serotonin the reason? So which effectively means they're already going to spaces like thanks to Google and the internet, there is so much information is available, Dr. Avinash. But as per you and your experience, what would you say that still today, what are the common signs and symptoms basically in your experience of anxiety and depression, especially in the Indian context?
Okay, so normally when someone comes to me, anxiety and depression are terms which are very widely used, and
Right.
people know about it. So they mix the two up very often. They get confused between the two. So they, anything is called depression, anything is called anxiety. That's what invariably happens. But when we look at anxiety, what's very important is that you have to have some amount of fear, some amount of worry. We tell them chhati mein dhad dhad hona, palpitations, ghabrat, something is going to happen, that kind of panic-like symptoms. Then they may feel little bit of breathlessness, numbness in the hands, sweating, and they feel worried and they keep worrying about small issues. So these could be, and they get some funny sensations in the stomach. These are all things which are, a part of the anxiety spectrum. In addition to this, there could also be an anxiety about meeting new people, which is there, and a worry when it comes to meeting new people, or a worry about small things. So worrying, meeting new people, or interview anxiety, or for that matter, anxiety if they have to speak on stage, is what we refer to as a social anxiety. And then we have, of course, the whole issue of some people who also have generalized anxiety, where they worry about small things, and that is coupled with a lot of body ache, muscle pain, multiple things which come up. You may also have people who have been through some trauma. So there could be some rape, some child abuse, some traumatic event in their life which manifests with anxiety symptoms later, which is more of a post-traumatic anxiety. Depression, rather, on the other hand, is fairly simple because the symptoms of depression, first of all, would be depressed mood or low mood. You would have crying spells. You would feel that, you're not able to focus on anything. Your appetite would increase or decrease based on how you feel. Your sleep may increase or decrease on how you feel. It could also happen that you feel I'm good for nothing and I'm hopeless. So you may feel that I have no future ahead, and you may feel there's no way ahead. You may feel helpless and there's no one to help you. So those are feelings that might come in. You may even feel that I am nobody and feel worthless. So that kind of a thing might come in. And some patients, of course, feel life is not worth living, and that element of suicidality also comes in. So those are the symptoms of depression. Now, I generally tell people that the moment you get these symptoms, it's important that you visit a mental health professional or a psychologist or a counselor, and at least get yourself screened, because it's better to pick these up early and treat these early rather than wait for it to escalate into a major problem.
Absolutely, absolutely. So, but have you seen anything which is different that we would say in an Indian context? Because
Yes,
approaching
yes.
is a very difficult thing. In today's times, I feel.
See, in an Indian context, I mean, context for that matter, sometimes, I mean, if you see a lot of patients, they use colloquial terms, so they just, say man nahi lag raha hai, rather than
Right.
saying they feel sad, or for that matter, or they might just say कि कुछ भी पसंद नहीं आ रहा है. They may not want to say that I feel low or sad. Or
Correct.
it could be that कुछ ऐसा बात हुआ है जो मुझे बार बार दिल को मेरे टोच रहा है. They'll talk on those kind of things. Or
Absolutely.
they'll say that for that matter कि मुझे बस कुछ भी पसंद अच्छा नहीं लग रहा है, कुछ करने का मन नहीं हो रहा है, घबराहट हो रहा है. That's it. They may not want to use the terms depression or
Right.
otherwise. And I think in India what happens is a huge, I mean, some sections are still patriarchal, so there's a male dominant angle which
Right.
we see in a lot of female patients, who have depression. So they're either subdued by the husband, or subdued by the father-in-law, subdued by the family, and they're not allowed to express themselves openly. So that very
Right.
often leads to a bottling up of symptoms causing depression. And anxiety, I think, is all around. And I think with COVID and the last 2 years, we've seen so much
Absolutely.
of anxiety because there's the anxiety of survival, there's financial anxiety, there's the anxiety of death, there's anxiety of losing a loved one, there's vaccine anxiety. I think you see all kinds of anxiety
Totally.
with which
Yes.
people come. And I mean, even if you're being tested for COVID, there's anxiety. Whether you're going to be positive or negative. So
Yes.
there's been anxiety in all ways. And I mean, there's a lot of grief-related depression that we see because in India, I mean, sending someone off after death in a very nice way is very important. The burial, the cremation, the mourning, the chautha, the terwa, these are all very important facts, I mean, which are there. But this time, what has happened is because of COVID, people haven't been able to mourn, well. They haven't been
That is
able
right.
to. The socialization of mourning is very important in the Indian context. The fact that people get together, cry, give each other support, which I think hasn't happened, and that's led to a lot of depression coming in. That I was not able to do my best for my loved one, even in the end. So
Hmm.
that I think is a big factor.
Absolutely, absolutely. So well said. I think the COVID has just added terribly to all our existing anxieties, which are anyway there as part of our lives.